Good morning, afternoon and evening. This is the conference operator. The European School of Oncology welcomes you to their 308th Grand Round. Today's session is Teenage, Young Adult Cancer, Most Relevant Problems in Cancer Care, held in collaboration with IANS. Questions will be received by Mrs. Pia Solsen of the Aarhus University Hospital, Aarhus, Denmark, who will discuss them with Mrs. Maria Cable, of the Coventry University, Coventry, United Kingdom, and Mrs. Nikki Pettit, of the Teenage Cancer Trust, West Midlands, United Kingdom. I will now hand over to Mrs. Maria Cable and Mrs. Nikki Pettit. Mrs., your line is now open.
Good evening from the UK. My name is Maria Cable and I'm a Senior Lecturer and Course Director at Coventry University, which is in the Midlands of England. I'm also on the education group of the European Oncology Nursing Society, and it's my absolute privilege to be here today to talk to you about some of the teenage and young adult cancer challenges in the UK. And I'm also very pleased to be joined by a clinical colleague, Nikki Pettit.
Hello there, my name is Nikki Pettit and I'm the Teenage Cancer Trust lead nurse based at University Hospital Birmingham. And I also work alongside Maria here at Coventry University delivering teenage and young adult education.
So we're delighted to talk to you this afternoon or this evening about some of the issues that we're facing here in the UK in terms of teenage and young adult cancer care. They'll not be unique to the UK, although we are perceived as having a very specialist approach to looking after teenagers and young adults with cancer, and we're very happy to share that with you. So this afternoon we will discuss age and adolescence, as it's very key in teenage and young adult cancer care. We'll talk about some of the statistics around teenage and young adult cancer. They'll predominantly be from the UK, but we will allude to some of the other statistics that are out there. But more importantly, we're going to talk about some of the specific challenges, and they include the themes of clinical care, service delivery, and what some of the specific needs are of teenagers and young adults with cancer. So, who are we talking about? Adolescents, youth, teenagers, young adults, young people? I think I've just used about 5 phrases that all describe those that are neither children nor adults. Young people. So we have mixed terminology. In the UK, we talk about teenage and young adult cancer care, but in Europe and the States and in Australasia, we will hear people talking about AYA care, adolescent and young adult cancer care. So essentially, it's talking about an age range of people. So if we try to define the age of adolescence, when we look at the World Health Organization's perimeters of adolescence, we see that they describe young people as those that are between 10 and 24, adolescents as those who are 10 and 19, and youth is defined as those that are between 15 and 24 years of age. So you can see it seems to sit somewhere between 10 and 24 years of age. However, when we start to look at that in terms of cancer care, it gets slightly more interesting. Our Australian colleagues determine that age range to be between 15 and 25, and that goes up to 15 to 39 in the States. Canada goes as far as 29. Europe and some European countries, they'll go from 15 to 42, but in the UK, and for the purposes of this talk, and for the services that we provide, we particularly talk about the age range of between 13 and 24. So, if I think back to my adolescence, which is some time ago now, I remember it as a time of great change, challenge, and culture. Clearly, we are undergoing huge biological change. We are physically growing up. We're getting bigger. We're developing, going through puberty. We're having significant hormonal changes. We also know that we're undergoing huge changes in the brain. There's an awful lot of synaptic pruning going on, so there are huge changes to the grey matter in our brain as well. Also, it's a great period of gaining independence. Independence, moving away from your parents, that's a very key feature of adolescence. So it's becoming independent of them in many ways, financially, emotionally, etc. The relationships that are formed and that change in adolescence are also key. We may feel as parents that as parents of teenagers or young adults that we may not feature as the most important person to them because their peers and their friends become a very significant part of their lives. So the relationships that form and adjust and remain during the adolescent years are very critical, and that's something we must not remember. Adolescence is also a period where often people's sexuality is determined. And for some, that's a very, very difficult time to try and come to terms with whatever that may be. Clearly, we see that's a challenge to an adulthood, but it's definitely a period when sexuality is considered and more often formed as a more permanent aspect of life. I remember my adolescence as a period of study and having to make decisions about my career, my education, my job. As for most adolescents in the developed world, that is an opportunity that they have, and they have to make very big decisions about applying for that and applying to that so that they can form a career for the future. Also, thinking about it, it was a period where I was even trying to get my driving license. So there are so many changes going on in the world, but actually the modern world that we're living in gives pressures, added pressures that young people now face that perhaps we didn't see when I was growing up. So clearly technology and the use of social media and all that comes with that puts pressures on young people as well as giving them some freedom. Please remember that you can click on the questions and answer buttons and your questions will be collated, and our colleague Pia will gather those and will ask them on your behalf.
Maria and Nikki, I actually have a question for you.
Thank you.
Can I pose it now?
Yes, please.
Okay, because you mentioned that in the UK age definition of the teenagers and young adults is 13 to 24, and that in Europe as a whole, patients are considered young adults up to 42. I think it points to the fact that it is increasingly recognized that there are specific and special needs to consider when you are 13 to 24 and get cancer, but that the supportive care needs are poorly characterized for young adults at age 25 or up to 40 or 42 at least, and that their specific needs are still left rather unattended and under-researched. So I wonder if there are any signs in the UK health system or in UK health policy that the attention would be extended to these young patients who face specific challenges, some similar to the younger group, but in their case also includes marital and family issues, young children, education and interrupted careers and economic problems. Do you have any experience in that?
Pia, I completely agree with the point that you raise in the sense that a line has been drawn in the sand for age, and the guidance that we have in the UK is up to 24, but quite naturally all of the questions and challenges and unique challenges of age, as you identify, do clearly continue on over and above this age group. I'm not aware of any changes in UK health policy that will extend the upper age limit. In reality and certainly in practice, what I'm finding is that as we have the ability and the opportunity to raise awareness of the special and unique needs of this age group, that other areas of the hospital are starting to sit up and take notice and think about the transferable nature of some of the approaches to challenges that we have addressed. It's very interesting. I was recently asked to speak at a hospital presentation on dignity and dignity in care, and the programme was very much about dementia and the needs of dementia patients and seeing people for people. And they were quite surprised when I stood up to talk about 16 to 24-year-olds, but before they fell asleep, I reminded them that actually everything that we talk about is looking at a person in the holistic sense and seeing them as a person. So hopefully we're leading a change, but whether it's going to ever be recognised in the sense of policy changes, that's not a question that I can answer.
Okay, go.
We'll proceed.
So we've talked about adolescence and some age definitions of adolescence, and now we need to bring this back down and return it to the statistics that surround cancer. So Maria and I have explored the UK statistics, and the Cancer Research UK is an absolutely fantastic website for any UK statistics. So we're looking at about 2,200 young people diagnosed each year with cancer, and that includes all cancers but just excludes the non-melanoma skin cancers. But this actually accounts for only 1% of all cancer registrations across the age range. Slightly more males in this age group than females are diagnosed with cancer each year. If we think about the incidence throughout the EU, it rose quite dramatically in the 1990s and then has stabilised in the last decade for men, but for women actually incidence in women has risen by about 10%. And that leads us on to think about survival, and it's important to acknowledge that survival from these cancer in this age group is improving, and that in the UK there's approximately 80% survival rate still at 5 years. And this rate, if you look across Europe, this can range up to 92% in Iceland, and that this is slightly higher survival rates in females than males. But it's important to acknowledge that the survival rate for this age group is significantly lower than for those in paediatric care and for those under the age of 16. Although we need to draw the attention to the fact that there is considerable variation in survival between diagnostic groups. And the next slide shows graphically some of the variation and the changes since the early 1990s in the UK. The most important thing to take from this slide is the fact that the soft tissue sarcoma has not changed significantly at all, and survival still remains quite poor from these. And when we talk about survival, unfortunately, we need to talk about mortality in addition to this. And we know that in the UK that cancer is the leading cause of death after accidental death. And that approximately 310 young people die from their cancer each year. And that within this, it's the brain and CNS tumours that are the most common cause of death. To link in with the fact that survival is improving, then clearly death rates are going to be falling, and this is very reassuring. And across the UK and Europe, since the 1970s, the statistics for death have decreased by about 50%, and this is very reflective of the improvements in treatment over the last 40-50 years. So just looking at the types of cancer that we're seeing in the UK, this graphically represents that. So we're looking at lymphomas and leukemia, carcinomas, germ cell tumours, and brain tumours, and central nervous system tumours. Excuse me, little cough. There's been some work to look at the causes of these types of cancer in the age group. I think it's important to acknowledge that young people get a whole range of cancer. Some of them get very paediatric type cancers, and some get very generally adult defined cancers. And there are some thoughts as to why this occurs. We know that the increase in UV radiation has shown increases in melanoma, excuse me. And that there are very interesting links to the HPV virus in the development of cervical cancer. excuse me, sorry, there are also many links that can be surmised through to the period of life and the life trajectory in regards to growth and hormonal factors during puberty that may trigger cancer in this age group. There are certainly some genetic links, Lee-Fraumeni syndrome, that can cause higher, as an example, that can cause cancer in this age group. And we're seeing, unfortunately, more secondary cancer due to cancer treatment as a child. Excuse me.
Have you got any questions at the moment? Any questions, Pia?
No, there are still no questions coming in, but
okay.
I can still put another one for you. Are you ready to have a question from me?
I'll progress, shall I?
And Pia,
or have you got a question? Sorry, Pia.
Yeah, I have a question for you.
Yes.
I think it's interesting to know if you know or think that the public awareness and national and local policies could help to decrease the time to diagnosing teenagers and young adults. Is something done about this in the UK?
I think we're trying to tackle that in a number of ways, and I think we'll come on to that later on in the presentation, because that is an issue for these young people. I think some of the charities are taking up that baton and trying to raise awareness that teenagers and young adults actually do get cancer, because many people would never even consider that would happen. In the UK, we have, I suppose, very, very recently in the past, since, say, April time, we've had a very high-profile case of a young man who has sadly passed away from his cancer, and he set up a Facebook campaign to raise £10,000, and a particular comedian picked up what he was trying to do and carried on Facebook, and actually he went on to raise £5 million for the Teenage Cancer Trust. But more than that, he raised awareness of obviously what the charity is trying to do, and awareness that teenagers do get cancer, and sadly for him, teenagers will succumb to the disease. So that was something we could never have planned. And I also know that it's very difficult trying to do some work with GPs, but GPs are, if in their career they will only possibly ever see one teenager and young adult with cancer in their lifetime. So we're trying to balance that with an ever-changing health system, and in fact today in the UK they launched another major change to the NHS and the way that it works. So it's ever-changing, and sometimes we continue to fall between the gaps. But I understand the reason for your question, and we face similar issues here. Yeah.
Yeah, okay.
Right. So just to talk about some of the clinical challenges that children or teenagers and young adults face, is that the survival rates for teenagers and young adults are less improved compared to those for adults and children, and we wonder why that might be, and we'll explain why that might be. The incidence in it is also rising. I think we can see that there's a general increase in young people getting cancer. One of the reasons that the survival rates may be less favourable is that actually access to clinical trials is poor. Often clinical trials have a cut-off age in children up to 16, and for adults they'll not start until 18. So those between 16 and 18 can fall short of a clinical trial and a child protocol or an adult protocol. And certainly in the UK there is some work going on that now challenges researchers to consider to give good reason why they wouldn't include a teenager and young adult in a clinical trial that they're setting up, or even whether they be for children or for adults. So that is definitely an issue. And this goes back to my next point goes back to what you asked about earlier, Pia. We know that many teenagers and young adults with cancer get a late diagnosis, and many of them are often only diagnosed when they turn up to A&E or to emergency services. And quite often that is because if they do keep going to their GP, quite often GPs will think that their symptoms are nothing to do with cancer and that they're to do with the fact that they are going through this major change in their lifespan. So all these physiological changes, so they've got growing pains, that they may have stress from exams, that they may have headaches from going out drinking, that actually not really thinking about that a young person might actually get cancer. So for some young people, they may have been to a GP to as many as 8 times before actually somebody thinks that something different may be going on here, that it's not just a sports injury. Also, with this age group, they're quite often reluctant to go and see a doctor because they think themselves it's just part of growing pains, or they've been excessive drinking, or they've just had a sports injury themselves. So there are multiple reasons as to why they receive a late diagnosis. But sadly for some, when they do go to a GP, they're not actually heard, and actually they could have been picked up a lot earlier. Also, some of the challenges that we're faced with is that actually there are very small numbers of teenagers or young adults in cancer centres, so it's difficult to get a collective. So you may have 1 or 2 in a sea of an adult ward or an adult department. You may have 1 or 2 in a big children's hospital. So actually people may not see that their needs are any different to children or adults. And also what hasn't helped, and I suppose in the UK we have had some help with that, is that actually some guidance in terms of what does a systematic referral pathway for these young people. So if this is their programme of care, where do they go to next? And we have actually had some guidance in the UK in 2005 that we will come on and talk about later in the presentation. Furthermore, as young people progress throughout their cancer journey, the care that they get at the end of life also can be a challenge, whether they're cared for in a hospice, in the hospital, or whether they want to have their end of life at home. And the services that are out there to help young people or anyone at the end of life can be a challenge. So sometimes adult teams don't feel it's necessarily within their remit of experience, and the child team, they may also feel the same. So the teenage and young adult may fall between these 2 camps. Also, we find that they have similar experiences when they don't have to be in hospital for long periods, and they can be out in the community where they need extra care in the community. So there's sometimes some disparity as to who should look after these young people in the community. When young people with cancer survive, they can also be faced with many, many extensive survivorship issues: financial, emotional, physical, social, in lots of ways. Quite often their friends have moved on, they're doing different things, and they have been left behind, so they have been removed from their social circle. They have had their education completely interrupted. The consequence of the treatment may have impacted them too. And furthermore, in terms of long-term follow-up, there's also challenges around who will continue to follow them up. Will it be an adult team, and at what point will they have to transition into that adult team? So if, for example, you spoke earlier, Pia, about these young people, once they get to 24, who looks after them if they've survived cancer when they're 25? Because this type of service that they get when they're in the teenage and young adult cancer service, if they get there, is very different when they then go to an adult service. They may not appreciate the age-appropriate aspects of that care. So the challenge is really that they often fall into no man's land. They fall between adult and paediatric services, and they are often referred to in the literature as the lost tribe.
So to guide us with our service delivery in the United Kingdom, this document came out from the National Institute for Clinical Excellence in 2005. This is clearly gold standard framework guidance for us to work towards. Well, it's interesting to note that any guidance with regards to how services were measured against this took a further 5 years before it was released. And the essence of the guidance for us in the UK is that care is centred around principal treatment centres. that these principal treatment centres are supported by designated hospitals, that there is a TYA-specific MDT multidisciplinary team working out of each principal treatment centre alongside site-specific teams. So in the UK, all cancer care is delivered with a diagnostic focus. For example, there's a breast team, upper GI team, a sarcoma team, but that measures for teenage and young adults have stated that there needs to be a psychosocial TYA service that umbrellas all existing services, and that young people must have unhindered appropriate facilities and support, and the element of patient choice must come into play in all this. Now, I could speak about these guidelines for about 3 hours, so clearly we don't have time for that and how these have implemented our day-to-day working in the UK, but just for you to take an essence of the guidance that
you can even see here on this map that geographically, for example, in Scotland, there are some centres, but actually people who are living on the Highlands and Islands, getting access to these may be a bit of a challenge, and equally the same for Wales and the southwest of England. This will be no different to, I'm sure, services that we see being developed in Australia or in other countries where geography is an issue.
And to note that this has led to very different models of care even within the UK, even with the same standardised guidance that we all have, that regional areas have developed very different models of care. So in my job as a lead Teenage Cancer Trust lead nurse, I'm constantly faced with the challenges of trying to deliver teenage and young adult cancer services within an NHS or a healthcare system. And Maria's already alluded to the fact that they don't really, young people don't fit anywhere in the sense that they don't fit in paediatric services. Adult services don't really want them. Sometimes there might be an older young person with a paediatric type of disorder, paediatric diagnosis, that there are also older young people with younger teenagers with a very adult-defined disorder, and that this actually takes a lot of collaboration and partnership working to make any small changes or to have any impact in service delivery. That we're working defined by age, not diagnosis, and that goes against all existing patterns and pathways. I think it's also important to identify that there are a lot of non-believers within the healthcare system who don't feel that young people need specialist services, and that all of these need a great change in culture.
Any further questions, Pia?
Well, there are no questions coming in, but can I pose another one for you?
Please.
When you are talking, it's obvious that the Teenage Cancer Trust have had an enormous impact on the level of teenagers and young adults cancer care in the UK and what you have achieved in the UK. Do you think that the existence of these organizations have had decisive influence on the health policy for teenagers and young adults in the UK as such?
Sure.
Yeah, massively.
And actually, Pia, my next slide actually talks about Teenage Cancer Trust and what they and some of the other charities have helped us to do in terms of delivering service. So yes, they have had a very loud and strong voice in championing the needs for teenagers and young adults, not just building wards and specialist units and employing some staff, but also lobbying government. They also had a very significant role in that, fundraising obviously to raise money to make differences to the care that young people receive. So there are other national and local and even regional charities who, without them too, we wouldn't see some of the advances. So for example, obviously Teenage Cancer Trust have got 28 specialist units, so buildings that are so the environment is what they have made a big contribution to there. They and some other charities will fund specialist staff, so for example, clinical nurse specialists, For example, Nikki's Post is funded by Teenage Cancer Trust. They'll fund other roles such as youth support workers, and others. Charities might fund roles such as social workers. So the role that charities have to play is huge. So aside from the service delivery, they will also be in a position where they can offer grants for a range of activities and support groups. I can think of the Ellen MacArthur Trust, who takes young people away on sailing trips to give them independence, and she's very committed to helping young people with cancer have an enjoyable experience and do something quite different.
But I think, P, you make a very real point in the sense that if charity, I mean, we have here 3 very large national charities, and Maria has already mentioned the fact that the multiple charity support at a national and very local level as well. But if charitable funding ceased on the 1st of November, that the service I live at the hospital would also cease. So young people would get their treatment, they would be in a bed, they'd have the chemotherapy, they'd have their radiotherapy, but they would have none of the additional services. And I think this is a big challenge for commissioners and for leaders in up and down the UK to draw attention to the pressures of delivering a service like this, that within a stretched healthcare system wouldn't be providing these extra and very valuable services, both to the young people, but also in the sense of finances as well. We're providing care in a stretched healthcare service, which is a massive challenge.
Actually, there's a question coming in now also about this. It's asking you how can we improve support for our teenagers and young adults in remote and rural areas who have limited local support? Do you have any suggestions there?
I think it's about being clever with how we interpret support. I think it's about using technology. I think it's about using engaging young people in a different sense to face-to-face working. I think there's no clear definition of what age-appropriate care actually is, and for me it's about holistic care. It's about supporting that young person to lead a normal life within a new normal of a cancer diagnosis. So I think it's about supporting young people remotely, in a sense of via the telephone or via social media, and signposting them to alternative ideas of support. Not everyone can travel, has the funds to travel, or even needs to travel. So, for example, treatment pathways might not even take them to a specialist centre for treatment. They may just have surgery locally and then be discussed at a young adult MDT and then not need any more input. So I think it's about trying to be clever with what you can do and not being distracted necessarily by an environment as the be-all and end-all for age-appropriate care.
And I think it's fair to say too that we're doing some evaluation at the moment where not every young person will get into a teenage cancer centre. So actually there might be ways where we can look for, rather than them coming in, where we can go out, and even if that just means giving them a call, speaking to them so that they know that there is an advocate for them who can help them navigate their way through their cancer treatment, is quite useful. And I think also we have seen very recently, in fact just this last week, where Canteen, who is the equivalent in Australia, have just launched a new 24/7-hour counselling and support service for young people via the web. So actually, I think there are things that can be done to support people in remote and rural areas that are not just to do with walls.
Yeah, and I think this leads us nicely on to our next slide, regards to navigating the challenges of service delivery, that there are multiple models that exist not only in the UK but throughout the Europe and Australasia, and that actually the challenges that we face are the same and are interpreted differently depending on the support and the champion and the time and the money and the people that are listening to you, and that service evaluations for models that are well established or new models that are being introduced are very powerful and will help to guide the future reality. We're not getting it right all the time here in the UK, most certainly, but we're able to reflect on models that are good and models that have worked.
So lastly, we'll talk about some of the cancer-specific needs. And actually, when we think back of our period of adolescence, all these periods of change, challenge, and culture, when you get a cancer diagnosis, it impacts on every single aspect of that adolescence. So it's crucial that we see the adolescent first and then work with them with their new diagnosis of cancer. We must remember what the period of adolescence is like and be aware of all of those issues.
And this slide just alludes to some of the ways that any healthcare professional or any voluntary service can support young people going through cancer, in the sense of thinking of the life trajectory and how we can support the normal changes through an abnormal period. So it's things like acknowledging the biological changes, for example, puberty that are happening, letting young people know that if they've just started periods, their periods might start, or acknowledging that the changes in their body might be increased or decreased. I think it's about services addressing with regards to hormones to make sure that fertility is considered and growth and the impact that hormones have on a healthy young person and how that impact is impacted when cancer and its treatment strikes that young person. I think it's making care and making services fit to young people. So, for example, with regards to the changes that are happening within the brain and the way that young people process their lives, make decisions, that as a TYA professionals we acknowledge and support the fact that at the beginning of a year of treatment they might be able and in a position to make decisions in one sense, that may change within a year because of the very nature of the changes that are happening to their body regardless of their cancer treatment. Their independence, Maria and I like the phrase about growing up and growing down, and that some of these young people will be fighting for their independence, but then actually when they're feeling unwell, they just want a cuddle from their mum, or they want a cup of tea made for them rather than battling to get to the kitchen themselves.
Or they have just flown the nest and they've gained their independence and they get sick and they're back at home and mum and dad have to care for them, their parents have to care for them again, so they have lost their independence that they had just found.
Yeah, and I think for teenage and young adult services to think about how they can maintain the old relationships that the young person had and how they can help them to develop new relationships if that's something that they want. We know that peer support is so crucial through a healthy young person's life, and how that peer support may change with the cancer diagnosis and also may bring the additional new peer support of cancer friends if that is what that young person wants. I think it's about, when we think about the sexuality, it's about supporting them being who they would like to be, who they think they can be, even down to simple things like promoting safe sexual practices, and not assume that just because young people are going through cancer treatment that they're not having sex, or that their understanding of the terminology that you're using when discussing fertility and sex and sexuality, that is clearly understood. Education and employment is so key and central to this age range, and we know that even in the healthy young people, employment and the education and employment market is so difficult for them. To think about services, how can TYA services support young people through the cancer journey? So, for example, in Birmingham we have a specialist teacher who's able to liaise and support with them through their journey and maybe help them to consider learning in a different way. And I think, like we've mentioned several times, that acknowledge the pressures of a modern world to these young people and the impact that that can have in both a positive and negative way as they proceed on their cancer journey. And this is what some young people have said that services should be delivering, and I think it's we can't talk about young people's services without having and checking in with young people themselves, and it's important that their voices are heard, and young people's voices are extremely powerful within the process of trying to change anything or implement any changes. And this slide just clearly shows some of the comments that young people have made about what they want from their services. So they want expert staff, they want to be treated as young people, they want to have the opportunities to socialise, and they want to be respected as individuals and feel comfortable and cared for in their environment.
Any questions?
There is actually one question from one of the listeners here for the session, because this person raises the challenge that is there, perhaps when numbers of teenagers and young adults with cancer are so small, because then it's maybe more difficult to establish a youth unit or special services when you don't have that many patients with cancer in that age group. And actually, I'm thinking about the difference between, I know Birmingham and I know some of the units in the UK where you have a lot more patients than we actually have here in Denmark in our unit. And to the question, I like to tell that in our department in Aarhus, we only have 4 beds for young people with cancer in a special unit for teenagers and young adults, and which are part of an adult ward, and that is actually another opportunity instead of having a big unit or a big ward for these young patients. So it can be done. I think we have, well, it depends, but between 15, maybe 20 new young patients every year, and that is it. And for that, we only actually need these 4 beds. So it's possible,
And I also think it's so important to not be distracted by the environment. I sometimes think the units can be very distracting from the care that is actually being delivered, and I think if you have the right team and the right people and the right approach, you could be anywhere, in a bus stop or in a empty room with white walls, but if you have the right team, then that's what's important. So don't be distracted by the lack of environment, because you have non-believers who say, oh, young people just need a side room and a games console. Well, actually, we know that they need so much more than that, and that is often not the priority for them. So we're very lucky to have units because we have numbers that can support them, but I would lose my unit before I lost members of my team.
I agree with you, And I think actually that's what the young people, they say themselves, that the most important thing is actually the attitude of the team.
And that not all, certainly from our experience, not all of the young people with cancer need to be in the beds on the ward. Services are structured within oncology, haematology, so our mainstays of treatment are chemotherapy. That's the right place for those young people to have their chemotherapy. But if you've had a brain tumour and you're about to have massive neurological surgery, then clearly the best place for your care is on a neurosurgical ward, not with a load of chemotherapy nurses. You need the age-appropriate needs shouldn't overtake the actual needs and the expertise that is required for their cancer diagnosis, and that's very important. We as a teenage and young adult professionals can easily visit a neurosurgical ward to support that young person, and I'd much rather do that than pluck them out of their highly trained, skilled environment and plonk them into a room that had good coloured walls, a free TV, and open visiting, for example.
I agree,
And I think also we've got to, I think if people understand what we mean, the key features of adolescence, then they are in a better position. So even using some of the assessment techniques, some of the assessment tools, and many are under review and under development, but thinking about what adolescents and young people are going through, thinking about their social behaviour, thinking about their risks of concordance, thinking of their education, and all of those issues are really central. So thinking of those things first and then building care around that.
And I think certainly as a teenage and young adult champion, a lot of my role and the role of my team is actually supporting non-TYA professionals to provide care to young people in their care. So it's about supporting those professionals to say, yes, it's fine, don't worry that that young person is reacting like that, this is very normal. It's about providing that reassurance to support more professionals and look after young people where they are.
I'm going to move on here because it's time's going on. So central to that is the essence of multi-professional working. And if we think of the words of Henry Ford, coming together as a beginning, keeping together as a process, and working together as a success. And obviously it took us a long time to get to where we are today. So at the UK, so this will evolve, and it does evolve, and it continues to evolve. And this is clearly a key feature of TYA cancer care, everybody realising that they can make a different contribution. So not just in their practice, but also in terms of our learning, and education is key. So learning that we learn with, from and about each other.
And that the job is never finished. So just because you have a service, you know, you might have a physical environment, or you might finally get key posts or key people driving something, that the job is never done, and that the situation changes all the time. So the working together for success is never ending. We may tick the box, but there's always new boxes coming to be ticked.
And also I think it's having the right people in that team. It only takes one or two people to really drive that change. So in the UK, we have some useful organisations who help us with education, or not just in the UK, but some useful organisations that are really recognising the needs of teenagers and young adults with cancer. And the first on my list here is a group called TYAC, and that's actually for professionals, and anybody can become a member of that. It's not too expensive, and they have a brilliant website, and they also run educational events. Obviously, we have the Teenage Cancer Trust, and they've been a great support to people nationally and internationally in terms of developing their services, and they're very happy to share their experiences. We also see some other European organisations such as ENCA and COP who have educational materials and are trying to do very good work in terms of defining and determining what teenager, adolescent, young adult cancer care is. Our colleagues in Australia are doing some wonderful work. That's Canteen. That's the Australian charity that is driving care for AYA care there. And in 2013, we saw a new group in America called Teen Cancer America evolve, and they're also trying to emulate in some regards what has been done in the UK. Also another USA alliance is Critical Mass, and they're definitely worth following on Twitter and Facebook, because they all offer some brilliant insights into the specialist needs of teenagers and young adults with cancer. So in terms of educating or training, what do we offer? Do we offer both? I think, yes, we certainly need to do that. Being an educationalist myself and working out of a university that offers accredited education, we see the program that we run here is online, because obviously the number of these patients are quite small, and so are the health professionals that are looking after them. So we have an online program that's for multi-professionals, so actually it's not specific to nurses or doctors, but it's definitely has a multi-professional focus. So we have an online program, which is our postgraduate certificate, but we also run some face-to-face modules, so sort of short courses, and they're accredited, and they have to do assignments, and they get academic credit for that. We also know that there's accredited education, an AYA oncology from the University of Melbourne. But also in the UK, and I guess around the world, we will see non-accredited training in different guises and formats. So for example, we'll have study days, local people will run their own study days. There's a free online learning module of On Track at Melbourne, and there's also some e-learning material with SIOP and ESMO. So there is a body of education going on in and around the world, but people are trying to do things so that people can be educated on their specific needs. Additionally, I wanted to share with you some of the other documentation, some that's come from charities, Tick Sergeant, these two in the purple, specifically talk about no teenager with cancer left out or no young person with cancer left out, and that's sort of looking at their social needs and educational needs. And then Macmillan have developed a competence framework for nurses for caring for patients living with and beyond cancer, and that also will address some of the issues for teenagers and young adults with cancer. But one of the other key things that's been led by a lady called Sam Smith, who is head of nursing at Teenage Cancer Trust, is this blueprint of care in the left-hand corner of the screen. And she has documented what is the essence of teenage and young adult cancer care. And that document is freely available on the web from Teenage Cancer Trust website and TIAC. And that's a very, very useful resourced, evidence-based document of what the essence of teenage and young adult cancer care is, and also highlights top tips. Something that I was involved in with Sam in writing is this document in the bottom right-hand corner, where we have documented what we believe are the nursing competences and career framework for nurses looking after teenagers and young adults with cancer. So it's exclusive to teenagers and young adults with cancer, so it won't include things like chemotherapy competence or end-of-life care competence, but it's trying to focus what we really mean about teenage and young adult cancer care for nurses. So that is also available freely from the Teenage Cancer Trust website and TIAC for people to download and to look at, and it will help them shape their service and identify the gaps in their knowledge and service provision.
And this slide is just to draw your attention to a piece of robust evidence-based research that is currently recruiting in the UK to look at whether specialist services actually add value. I would strongly recommend that you visit the Bright Light website. So it's all very well those of us that are involved in specialist services saying, oh yes, specialist services are wonderful and add value, but where is the actual evidence base? And this enormous piece of research that's across site nationally throughout the UK, working collaboratively with centres, and that's both principal treatment centres and designated hospitals and local hospitals. It was trying to capture every newly diagnosed young person with cancer and then follow them on their journey at key points to look at their experiences up to 3 years out from a diagnosis. So what actually is the association between specialist treatment and TYA services and young people, and also looking at the cost that may be involved with that, and also at carers. So an incredibly valuable piece of research.
We're all waiting for the outcomes of that.
Yeah. So just to summarise, we were asked to look at some of the challenges of delivering age appropriate care, and I think it's important that we acknowledge that patient numbers are small and that the care that these patient group needs is complex and is expensive. And we know that traditionally and ongoing, young people are treated with either children or older adults, and that actually age-appropriate units are a relatively new approach to care. We know that geography can make care difficult, and that we don't always know where the young people are, and that these young people don't necessarily get into specialist services. And that we know that support and care is not equitable throughout the UK or indeed anywhere. And that we know that teenage and young adult cancer is a new and emerging specialty that is not always recognised, and that there are political challenges that lie within this, and as we've alluded to, that they are ongoing challenges and will continue to be challenges for us.
So sort of lastly, really, what are the take-home messages? Well, for us, I think primarily it's important that you see the young person first with cancer second. That's really crucial, particularly because of the age and stage of life that they're in. Also, what's very powerful are young people's voices. They are very powerful and very loud, and they can be very articulate, they can tell a very powerful story, and they can really help you lobby for change. And sometimes these changes can be very small, but make a huge difference. Some of these changes, such as not having an early morning routine on a ward like you normally would have on an adult ward or a children's ward. not difficult to implement, but really worthwhile and makes a big difference to young people. Can you think of any other small
I think there's loads of small changes. So even just seeing the young person for a young person, trying to make the hospitals fit the young person as best you can. We can't change the big things, but you can make a massive difference with the little things. So even just giving them a bit of extra time where you can, or bending rules and boundaries where you can, and just acknowledging them as a young person and seeing them as a young person doesn't take any more money or necessarily or more time, and may benefit you massively in the therapeutic relationships that you develop with these young people.
I think if you can foster a like-minded community locally, you will travel far, because you can then easily become joined in the international network, and there's a definite momentum growing internationally of trying to really make a difference to teenagers and young adults with cancer in the professional sense. Don't reinvent the wheel where you can. I'm sure many of us have been here for a long time and have experience of what works well and what maybe doesn't work well. People are generally very happy to share that. I think just educate, learn, network, collaborate, and be a champion. Absolutely, be a champion. Don't lose heart, because you can make a difference, and you can use the young people to work with you to make a difference. So we're coming to the end of our presentation. We would really like to thank EONS and ESO for inviting us to give this presentation. It's been a great honour for us, a real privilege for us as nurses to be able to share with you some of our experience and expertise. I think we would also like to thank our own organisations from where we work, and Teenage Cancer Trust, and particularly Sam Smith, who couldn't be here to join us, who had hoped to be here to add her contribution, as her contribution has been invaluable to nursing teenagers and young adults with cancer particularly. Please follow us on Twitter if you wish, and if you've got any questions for us directly, we're happy to take them by email, although I do know that there is an Ask the Expert facility here as well. So that's the end of our presentation, but we're very happy to take questions from you, Pia.
Yeah, I think we need to end the session soon, but I'd like to say that I guess that the challenges you may mention in the care of teenagers and young adults in the UK are the same in most countries. And there are so many questions that we can share, and I am so happy to know that the awareness of young people with cancer is growing in most countries at the moment. And at least in Denmark, where I work, I see a rising interest in doing something special for this group of patients that actually fall between the chairs, as we say here. And I also like to say that you mentioned a lot of organizations, and I'm happy to know that there is a pan-European multi-level program in progress, led by the entire, or the ENTYAC organization, that actually tries to collaborate and to share experiences and interests between pediatricians and oncologists, so that we together can take this huge challenge forward and collaborate both in research but also in the clinic and in practice. So I thank you for your presentation. It was excellent, and I hope that our listeners have gained a lot from it.
Thank you. Thank you. Thank you. Thank you, Pia. Good night, everybody.
Goodbye. Bye.
Bye.
Thank you, Mrs. Cable. Thank you, Mrs. Petit, and thank you, Mrs. Riss-Olsen.